Okay, now we come to the last speaker of the session, Dr. Fiona Samuels, head of the Emphasis Research Project at ODI, and she's a social anthropologist with long years of experience in all three countries, Asia, Africa, and Latin America. She's working specifically on these issues, linkages between health, HIV, AIDS, vulnerability, migration, and access to services. Over to you. Thank you.
Thanks very much. So I'm going to bring the discussions back a bit to emphasis now. We've heard a lot about sort of national level pictures from these three countries, and I thought, and I think it would be quite nice now to bring it back to emphasis and talk a bit more about what we were doing in terms of the research front. Just before going through my slides, I think I just wanted to highlight a few things from the ODI perspective, and in fact how unique this emphasis project was from a research perspective as well. So I think what was quite unique for us was that for 5 years we were doing operations research. So we were doing research around the interventions, and we were sort of conducting both baselines and follow-ups, but also very small focus studies, which gave us quite a lot of insight into what was happening. And that's quite unique for ODI to be able to do this research alongside the interventions. I think also what was very exciting about this is that as we've already heard a lot from the morning presentations, is that we did everything in this project. We did programming, we did research, we did advocacy, we put it all together. We had 5 years to do this all in, and we were able to influence to a large extent national and regional policy, which I think it was a huge achievement, and as as we have all these policymakers speaking about these things, I think we recognise a lot of what was happening in our project is reflected in some of these findings. And generally, I think as you were saying, I think what we were able to do in a lot of the research was actually bring the migrants to life. I think we learnt about their stories, we learnt about the different aspects of migration, and I think we contributed to this growing body of literature. So briefly, the purposes of the research, as we've heard, it was to inform the project as it was going along, and I think as we've already heard, what was so innovative about this is that we were able to be flexible. The project was able to take on board some of the findings as we were going along and include them into the design and redesign the projects in a very sort of flexible and sort of proactive way, which is very exciting for a project like this. We were also able to fill in gaps in knowledge to add to the evidence base around cross-border migration and HIV. So bringing these two areas together is actually quite unique. So we have this rich data on that. And we were also building capacity because a lot of the team members of the emphasis, their partners, partners, were involved in the research projects in different ways. So I think that was a very important part. In terms of the organization of the research, we were providing oversight, and we were helping in the methodology and the analysis in the write-up. And we were working very closely with the regional research manager, who is Mambira, who is in the audience. And so she was the key contact point for us. And she, in turn, was coordinating and liaising with the emphasis team, the in-country research institutes and consultants who actually did the research. So there's a lot of collaboration and partnership on that, and building capacity around that as well. And as I've just said, we had local international institutes carrying out the research, guided by us, but also they had a certain level of independence, so some of the findings we can say were independent from us. And the care teams also did a lot of the research as well, and their partners. So the kinds of research we did, I mean, I can't go into all the details now because there's a huge amount, and I think a lot of the briefings that you've seen in the corridors will give more details on these research. So please do take them and ask us if you would like further details, and also people from the countries here who were very heavily involved. But we did desk research, and for instance, one of the briefings we produced, which is on the basis of a long report, was around the policies and regulations from the three countries, both in relation to health aspects and HIV, but also around migration policies. So we did quite an in-depth review of those types of policies to understand where emphasis was getting into, in the 3 different countries, where it was, what was happening in terms of these policies. We did quantitative work. We did structured closed questionnaires. We did a whole range of qualitative studies, in-depth key informant interviews. We did observations. We did group discussions. A whole range of stuff. In terms of the locations of the research, as we've heard a lot, what was also very unique about this project, also from a research perspective, was the ability to do research in both in source, in transit, and destination sites. And that is actually quite unique in the migration world, to have this body of knowledge in these 3 locations, in these 3 countries. That is very unique, and it's very valuable. And there I also indicate a few sort of types of places where we did the research, ranging from bus stops to homes to clinics to workplace. So we covered a whole range of locations. And also respondents, obviously our focus was on migrants and their spouses. But we also talked to other family members. They were included in the surveys at source. We talked to NGO representatives of different kinds. And then we had a whole range of key informant interviews, which were very critical for us in sort of getting a broader perspective of the dynamics of migration in these 3 locations. As said, I can't give you details of all the research or all the findings, but I thought it would be quite nice to give you a snapshot of some of the studies we did and the types of respondents that we spoke to. So the first what I want to talk about was the baseline and end line, which was a questionnaire, and this was quite a rigorous survey we did. We had over 2,000 respondents at baseline, and over 3,000, almost 4,000 respondents at end line. We used control sites. We've just recently put out the briefing which summarizes this quasi-experimental study result at the end. And I'm not going to go into details on it here, and there's a full report available. But we used a structured questionnaire for that. We did it in the source and destination sites. And the contents of the questionnaire had different modules, and some of the modules are up there and included the sociodemographics, sexual behavior, family planning, knowledge and attitudes around HIV and AIDS, stigma discrimination, and gender norms. So that was that study. Alongside that one, we did what we called a qualitative baseline or vulnerability study, and this was actually a study where the care officers and their partners actually did this one. So it was very much around capacity building as well. And this was a qualitative study. We did mostly in-depth interviews, though we also spoke to key informants. And again, the types of modules we used were very similar to the quantitative baseline. And in a way, we did this in order to help us triangulate and sort of speak to the findings of the quantitative data, to see what was coming out, to illustrate them with case studies and stories. And again, we have a briefing which brings together the quantitative baseline and qualitative baseline. Another study we did, it's just to give you a flavor, we looked at Bangladeshi sailors. And we thought this was a particularly interesting group, I think, and this was particularly from the Bangladesh team, and please correct me if I'm, please add to this. I think they felt that there was a lot of movement, of sailors, and we actually knew very little about them. So we wanted to find out a bit more about their characteristics, and what their knowledge was about HIV and AIDS. So we did that type of survey in a qualitative and a small quantitative in ports in Bangladesh and India. Again, this is quite unique from a sort of research perspective. We did surveys focusing on people living with HIV and AIDS to try and find out issues around their access to treatment as they cross border. And I think we've already heard this morning about how, as a result of some of these findings, the program was actually able to facilitate continued access to antiretroviral therapy as people crossed borders between India and Nepal. And I think that's a huge achievement, and I think something that the project should be really proud of. And again, I think the information that came from these studies helped emphasis design these interventions. Another study was what we called the Comparative Study, and this was trying to get at whether we could actually distinguish the effects of the project in terms of just migrants receiving it and then migrants and their spouses. So we looked at migrants in India, and then we traced them, traced their families back to Nepal, and we talked to their spouses. And we compared it with migrants whose spouses had not received the service. And we actually found, it was a qualitative study, and we actually found really a lot of difference between the cases where the migrant and their spouses had received it. And I think what stands out for me very much is sort of much more dialogue and communication between spouses as a result of receiving these awareness-raising interventions, which ultimately, you know, can sort of lead to the empowerment of women as their sort of decision-making is improved. They're able to negotiate safer sex. They talk about remittances, as we've heard a lot about remittances. So I know I've got probably less than 1 minute left, but I just wanted to highlight a few findings that our research finds highlighted. So we found out a lot about the patterns, costs, and conditions of migration. We found out about brokers. We found out about the kinds of people who move. You know, they're sailors, they could be children, school children, they could be women. We found out about the kinds. We found out about the ages as well. Somebody mentioned that. I think it was a very important aspect. We also importantly talked to the families and the spouses left behind, and we found out about the gender dimensions of this, you know, how it impacted women left behind, and, you know, what were their behaviours as well. Working patterns, conditions. We also worked a lot, we found out about rights and entitlements, so both what people knew about them and then what they were actually, what they knew about them and how they were actually playing these out in their countries. In terms of health access and HIV, I mean, I think we found that challenges in health access remain, and I think some of the recommendations that came out, and I think that we're working on a sort of at policy level as well, is we need to increase access to other rights and entitlements to migrants as well in order to address their HIV and health-related access. There are often structural barriers which are affecting women's vulnerability, which go beyond the barriers around HIV, which we need to deal with. In terms of HIV knowledge and awareness levels, we found from our research that it is improving, but it still work needs to be done. For instance, I think, please correct me if I'm wrong, I think that there's been a push now to try and get migrants to be considered a vulnerable population for HIV, a most at-risk population, a MARP, in I think countries like Bangladesh, where they were not considered. The epidemic tends to be concentrated in most at-risk groups who are sex workers, injecting drug users, etc. And migrants tend to be excluded from that. And I think this helped to push them back onto that agenda. And we need context-specific strategies to reach remote areas, and particularly women. And I think Emphasis has been really successful in doing in setting up spouse groups, doing door-to-door outreach, etc. My final slide, stigma and discrimination. We asked a lot of questions around that, and it still exists, and this is a perennial problem in the HIV world, and I think we found it particularly high in Bangladesh, but I think progress is happening. And I've already spoken about people living with HIV. I think methodologically, I mean, we can talk a lot about how we did it, but I suppose I just wanted to highlight a couple of challenges that we faced in the research, and it's particularly trying to identify migrants in certain countries, and this is particularly the undocumented Bangladeshi migrants in India. We had a lot of challenges accessing them, including them in our surveys. But we got around it, we managed, we developed strategies, and we were still able to say that our research was rigorous. And I think I'll stop there. And if you have any more questions, I think the members in the audience from the Emphasis would be very able to answer them as well. Thank you.